another big reason actually why I love inpatient so much, is because you don't feel like you're your own island. You are constantly talking and working with the occupational therapists, speech therapists, even the nurses, because again, they're the ones there from whatever 7 to 3, 3 to 11. They're the ones seeing that person for 8 plus hours. I get my awesome window for an hour and a half or two, but they're the ones seeing morning, afternoon, night. And I ask them whenever I go into a patient's room, like, well, I mean, I always chart review anyway, but if there's anything that,
Right.
and we discuss with our doctor all the time too, but with OT, how they do getting dressed this morning, how did they do, making a meal or whatever it might be, getting, in the shower, did they need help with that transfer or speech therapy? How are they doing cognitively? Is there any strategies that you're doing that I can incorporate in my training so that it's carried throughout all of their therapy interventions? So it's a huge team process, and I really think that benefits the patients.
Do you think more stroke patients should look for a team approach instead of that island of a physical therapy office?
Yes, I do, because again, I learn from my other colleagues even more about my patient, because again, I'm with them for that hour or so, but the OT might have seen something completely different, and the speech therapist might have seen something completely different. And if we can all come together and say, hey, this has worked really well, or this has not worked well, or whatever it might be, then I think that truly benefits the patient the most, because we're all on the same page.